Welcome to our channel. You know me, I'm all about using my knowledge to help you understand your body better. Today, we're diving into a fascinating area hand deformities. Now, before you get any ideas, this isn't about reading palms. We're talking about how the shape of your hands can actually point to some underlying health issues. It's pretty amazing how much our bodies reveal if we know what to look for, right? So let's get started and uncover the mysteries hidden in our hands. Have you ever heard of a hand that looks like it belongs to a midwife? It's called a coucheur's hand, and while the name might sound strange, the condition is a real sign of something deeper going on in the body. You see, this hand posture, sometimes called tetany, is often linked to muscular problems or even issues with electrolytes. It's like your body is trying to send a signal through the way your hand looks. Now let's talk about club hand, also known as talipomenius. This is a congenital condition, meaning it's present at birth, and it results in a hand that appears, well, clubbed. It's often due to bones in the hand not forming as they should while a baby is developing. The good news is, with early intervention and sometimes surgery, individuals with club hand can gain better function and live full lives. Imagine your hand swelling up and looking like a crab claw. That's what can happen with a condition called crab hand. It's not pretty, and it's usually caused by a bacterial infection called erysipeloid. This infection often affects people who work with animals or handle raw seafood, so it's a reminder that hand hygiene is crucial. The good news is, with antibiotics, we can usually treat this infection effectively. Now this next one sounds a bit strange: frog hand. It happens when an infection sets up shop in the middle of your palm. This space in your hand is actually quite vulnerable, and if bacteria get in there, it can cause swelling and make your hand look puffy, just like a frog's. The key is to catch this early and treat the infection before it gets out of hand. Okay, this one is a bit more serious: ghoul hand. It's a severe deformity that can result from a chronic infection called yaws. This disease is more common in tropical areas and often affects children. It's a reminder of how important it is to address infections early on and to provide access to healthcare for everyone, everywhere. Ever heard of a griffin? They're mythical creatures with the head and wings of an eagle and the body of a lion. Well, there's a hand deformity called griffin claw hand, and it gets its name because the fingers curl in, resembling a claw. This condition is often caused by damage to a nerve in your arm called the ulnar nerve. Sometimes it can be a sign of something else going on, so it's always best to get it checked out. Now let's talk about spade hand. Imagine your hand becoming broad and thick, almost like a spade. This can be a sign of conditions like acromegaly, where your body produces too much growth hormone, or myxedema, which is a severe form of hypothyroidism. It's amazing how our hands can hold clues to hormonal imbalances. This next one is called trident hand, and it's often seen in people with achondroplasia, which is a type of dwarfism. The hand takes on a trident-like appearance with the fingers splayed out. Achondroplasia is a genetic condition that affects bone growth, and while it can come with challenges, people with this condition live full and meaningful lives. Here's another hand deformity associated with achondroplasia: starfish hand. The name comes from the way the hand spreads out, resembling a starfish. It's another example of how our bodies can express genetic conditions in unique ways. Remember, understanding these conditions is all about promoting acceptance and inclusivity. Finally, let's talk about catcher's mitt hand. This condition, often seen in reflex sympathetic dystrophy syndrome, or RSD, causes the hand to swell, making it look puffy and stiff, just like a catcher's mitt. RSD is a complex disorder that affects the nervous system, and it can cause pain, swelling, and changes in skin color and temperature. Wow, we've covered a lot today. From a coucheur's hand to catcher's mitt hand, we've seen how hand deformities can be like little windows into our overall health. Remember, these conditions are often signs of something else going on in the body, and early detection is key. If you notice any unusual changes in your hands or your child's hands, don't hesitate to reach out to a medical professional. It's always better to be safe than sorry, right? Thanks for watching. If you found this video informative, don't forget to like, share, and subscribe for more medical insights. See you next time.